Hello and welcome to today's McMaster University Continuing Education and Caregiving Essentials webinar. What do medical professionals need to know about family caregiving and how can they support us best? I would like to begin by acknowledging the land on which we reside. McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Haudenosaunee nations, and within the lands protected by the Dish with One Spoon Wampum Agreement. My name is Jennifer, and I'll be your host on behalf of McMaster Continuing Education. Today, I'm joined by our facilitators, Donna Thompson and Dr. Sharon Anderson. I'd like to introduce Donna Thompson. Donna is a caregiver, author, and educator. She's the author of 2 best-selling books on caregiving, including The Unexpected Journey of Caring. Donna also facilitates our free online course for caregivers, Caregiving Essentials, and she is a co-designer and co-instructor of the Family Engagement and Research course, both here at McMaster. And I'd like to introduce you to Dr. Sharon Anderson. Sharon Anderson is a family neurologist and family caregiver. After her husband, John, had a stroke at age 46 in Ottawa in 1997, Sharon went back to university and completed a Master of Education in Community Rehabilitation and Disability Studies, a Master of Science in Public Health, Health Promotion, and a PhD with Dr. Nora Kending in Human Ecology, Families and Aging. She has worked for Dr. Jasneet Parmar as the research coordinator in the Caregiving Centered Care Health Workforce Education Co-Design Program since 2018. Donna, I'll hand things over to you.
Oh, thank you so much, Jen. I am really excited about today's webinar and the conversation that I'm going to have with my friend Sharon Anderson, whom I know is so passionate about caregivers and about this project. It is really a remarkable project that I've had the privilege of participating in myself as one of the many co-designers who are caregivers, who are service providers, and who are contributing to the evolution and the creation of this remarkable training tool that is focused on how we can care for family caregivers as we care for the patient. And I have so many questions for you, Sharon. But first of all, I want to ask you about why. Why did this project with the principal investigator, Dr. Jasneet Parmar, how and why did this project come about?
Oh, thank you so much for inviting me, Donna. I just love talking to you. I need Donna time all the time. So how did this come about? So in 2013 actually, Dr. Jana Hawley-Ridley-Duke, Dr. Natalie Jetta, Dr. Jasneet Parmar, we're all talking and noticing that the family caregivers that they were seeing as neurologists, geriatricians, care of the elderly doctors, that their caregivers were getting much more stressed than they'd seen them. And so what they did in 2014 was they convened a meeting to just ask multidisciplinary, multi-level providers and family caregivers, what do we need to do for family caregivers? And honestly, I think Jasneet and the other physicians actually thought that really what it would be was a support group or some kind of respite. And they were quite surprised at that first meeting when family caregivers said, you know, it's the interactions with healthcare providers and the health system that are really stressful. And so they wrote up the meeting results. Dr. Jenna Holyrood-LeDuc and Dr. Leslie Charles also wrote up another paper about that. They convened another meeting in 2016. And again, the same thing. It was really clear in that meeting that they wanted family caregivers and healthcare providers said that it was these difficult interactions that they were having in healthcare, that healthcare providers were saying, you know, it's difficult to interact with family caregivers. We don't have time. You know, we don't know what to do with them. And family caregivers were saying, you know, we ask them questions and they ignore us. They leave us sitting in the waiting room. And again, wrote up the stuff and published some academic papers. And in 2018 or 2017, one of the family caregivers at this consultation stood up and said, if you're not going to do something for us, if you're not, we're leaving, we're walking out. And so Jasneet at that point said, well, okay, so if you want to educate healthcare providers to support family caregivers, we need competencies. So in 2018, that's what I worked on, was developing a competency framework, the Caregiver-Centered Care Competency Framework. What competencies do healthcare providers need to support family caregivers? And then from there, then the question is we need education, and what should that education be and look like? And so the co-design process, because that's essentially the consultation process, was a co-design process, and we just continued that to develop the education.
Yeah, amazing. You know, before we go any further, first of all, I want to just mention that I'm delighted that we have Rachel from Southend-on-Sea in the UK with us today. I used to bring my kids to Southend, to the beach, when we lived in England. It's a beautiful place. And she comments that the stress in the context, more than any impairment, is also confirmed in Joe Griffin's work, published in 2020. And, you know, so more and more people are noticing this phenomenon of the struggle that we caregivers have when we're trying to communicate with healthcare providers, and it's just not working. You know, I'd like to show a short video that will give people a real flavor for the suite of video training tools that you have created at the University of Alberta. So if we can go to the first video, that will be great. So this is Recognizing the Family Caregiver Role, episode 1.
Yeah, so all the videos are all composites of what our co-design team has told us in what they've told us in the co-design meetings. So we talk about what has happened in your lives that made it difficult or easy, both from the care providers part and the family caregivers. So this video, in the advanced caregiver training, they follow a fellow whose wife has a stroke and they have 2 children. In the COVID module, it follows a nursing home administrator and the problems that happened when they tried to shut down the nursing home. And
I'll see you on Wednesday, Mrs. Fawcett. Oh, hi, Chad.
Hey, how did Mom do today?
She's getting stronger. We had a good session. We'll have another on Wednesday.
Cool.
Looks like your family's home.
It happened. She lifted her stick and I got it in. Chad, I scored a goal.
Good for you, Carly.
Well, run up and tell your mom. I'm sure she'll want to hear all about it. Hi. Are you one of Leanne's nurses?
PT, physical therapist. My name's Natalie.
Hi, I'm John Fawcett. And you've met Chad over here, and that whirlwind that went rushing past you upstairs is Carly. How's Leanne doing?
Good. Tired, though. She's frustrated that stroke recovery can be so slow.
We're all frustrated with that.
Chad, adjust. We all depended on Leanne. She was always so healthy. The stroke has been like a thunderbolt for our family. It's still pretty new for all of us.
Of course. Recovery isn't just hers, is it? I should get out of your way now. You have your hands full.
Oh, you have no idea. Carly has hockey 3 times a week, and she has skiing lessons on the weekend. Chad's on the swim team, which means early mornings. We're all on different sleep schedules. Leanne needs help eating. She needs help getting from room to room. Mostly, I carry her. I sort through her pills, and I pick up the new one at the pharmacy. Chad's given up his bedroom for the rehab equipment. He's sleeping on a couch in the basement now. Carly needs new glasses. The roof is leaking. Car needs repairs. We've lost Leanne's income, and I'm not always able to work from home. We've been to the clinic and the hospital twice each this month. And when Leanne's asleep, I worry that she's having another stroke. She gets frustrated with me when I can't understand what she wants. Well, I get upset too. Yesterday, I found her in the kitchen crying because she'd forgotten how to make a sandwich. So, can you help with any of that? Well, thanks for all that you can do.
So that is the first episode, and it sort of sets the stage for, as you can see, the culture and the context of caregiving. Certainly you and I, Sharon, can really identify, especially you as a spouse of someone who suffered a stroke. And my dad had 3 strokes when I was a teenager. And of course, I've been a lifelong caregiver to our son and my mother. So a lot of what the father said in that video really resonated with me personally. And I bet it did with you too.
Well, you know, the thing, this shows young caregivers as well, because most oftentimes that how those children are also thrown into caregiving isn't recognized, and they're not recognized as caregivers. You know, they're oftentimes the younger daughter going up to talk to her mother, tell her about the goal, back to that normal life. How do we get on with the rest of your life after stroke? And part of that is putting those things back together again. You know, you had that conversation a couple of weeks. Last month, I think, with Sammy Winemaker, and the question always is, you know, how do you live with whatever you've got to live? As a caregiver, you're the one that's kind of sorting this all out and trying to figure out what to do, how to make the person's life better, but you're also dealing with all of the family things, and that's really what our co-design team wanted to show in this first video. The other thing that happens when healthcare providers watch this, you know, they'd seen the scripts, we'd worked through the scripts a lot, took us several weeks, but they said, you know, say something, you know, say anything, say something, you know, that, and, you know, so it sets, you're right, it sets that up for how do we work through this with education? What's the education going to do for you?
You know, and there are so many questions in the chat about that uptake. How first of all, can you count the number of people who've taken this course? Who are they? And what do they say about it? What do healthcare providers say about the course?
Right. So we also are a research program and we evaluate this very stringently. So for the foundational education that's been online since November 21st, 2020, there's over 5,000 people have taken it. The evaluation's been published in BMC Health Services Research, and we are also evaluating this. So as providers take it, we're actually using the Kirkpatrick Bar education evaluation framework. So there are 4 levels to that. So the first level is, are you satisfied with the way the education was delivered? Did you like the videos? Did you find it interesting? That's that satisfaction with the education. The next level up is, did this education change your knowledge, attitudes, and behaviors? And then the next level up is, did it change behaviors in practice? At the 4th level, there's 4A and 4B, and what did you change in practice? What's the difference in practice? And then did it make a difference with caregivers? And we're working on that 4B part. We're going to look at the foundational education in long-term care and the difference that it makes to whether caregivers feel there's been a difference in communication and some of the other things that they get from the healthcare providers in long-term care. And we will do that with this education as well. So how many people have taken this? So the first module, recognizing the caregiver role of the advanced education, has been online since December 1st, actually. And there's been about 250 people that have taken the that particular module. And as they come online, they've come in live, they're all online now. The last one was online this morning. And as people have taken it, we've had lots of people that have said, where is the last module? we really want to finish this. It's really good. So we're really pleased with the feedback.
Yeah, that's great. Suzanne in the chat is asking, will this education, do you think, be mandatory in medical schools, in nursing, social work, allied health education institutions? Do you think it will be part of the core curriculum eventually?
So it may be in Alberta. So in Alberta, the Bill 11, the new Continuing Care Act, is mandating home care providers to actually ask family caregivers about their needs and then to signpost them to services. And the tool for doing that, asking the caregivers about their needs, is the CISNAT. And that's embedded in our Connect Care system, and it's embedded in Meditech. So it's there for healthcare providers to use. And many of the providers in the Edmonton zone are doing that. We've also done a small study in the Edmonton zone with using the care support needs assessment tool, so assessing family caregivers' needs and providing them with what they needed. That study showed is that it enabled people that were very close to needing long-term care to remain at home. Most did. I can't remember the exact numbers now. It's been a while since we've done that, but it was about 58 of 63 or something like that. So it was most people were able to stay at home, and those were people with really high needs. The other thing that it did was it reduced caregiver distress. The story that was just really touched my heart was the caregiver who said at the first interview, her blood pressure was dangerously high. And the number that she gave was over 200 when she started this program. And at 3 months, it was down somewhat, but it wasn't normal. And when we interviewed her again at 6 months, she said, it's just been a lifesaver. She felt like a wife again. And the other thing that she, as well as, she wasn't just caregiving for the person she was caring for, but she was also, so there was a family life, because that, and the other thing is her blood pressure was normal. Wow. So, it's those kinds of things. And it's interesting because we talked to the occupational therapists at the University of Alberta a couple of weeks ago. Lori Caforio Lori Caforio is a family caregiver. And she talked about how that stress makes a difference as far as diabetes is concerned and her blood sugar levels. So there's what happens is we need to be concerned about family caregivers' well-being, and not just, and sustaining care is important, but their well-being is important too. And that's what this program is meant to do. So
Yeah.
how do we do that?
Yes, I mean, first of all, there are so many questions I have, but I'll start with this one, which is there are many, many barriers to instituting this type of caregiver care. One of those barriers is that the caregiver is not the patient, is not the home care client, the patient is the center of patient-centered care. And so how are you able to encourage providers to say, even though the family caregiver is not your patient, you need to approach the conversation with the patient differently by including the caregiver? So seeing the patient with the family caregiver as a unit. And are you getting pushback on that? How, there is a culture and context of caregiving, but there's also a culture and context of the delivery of healthcare and all those people who do that every day. And I would say, wouldn't you, Sharon, that typically the culture and context of healthcare provision is not caregiver friendly?
Well, absolutely. You are absolutely right. Dr. Parmar worked on the geriatrician's competencies, and there's nothing about caregivers in there. She said, we overlooked that, because
Yes.
You're right, that culture and context of care. Caregivers have not been included. Certainly there's some talk now about that triad. How do we talk to the family caregiver, the patient, and the doctor or the healthcare provider? But there's now lots of evidence from other countries on how do we include the caregiver. So in the United Kingdom, family doctors identify the caregivers and signpost them to services. They're actually reimbursed for that. In the US, we've got the CARES Act, there's several CARES Act. This has dots between the letters, but what it is if a person is admitted to hospital, they're mandated by law to ask the person if they have a family caregiver, make sure, and the family caregiver is recorded on the chart. They're notified of when the discharge date is, and they're provided with instruction on what they need when they go home. And
this is so basic.
Well, and Dr. Janice Misaki is a neurologist who works with Parkinson's patients, and she says, why would we not do this? It's better care for the person, that our patient. We work together. What caregivers do is so important. They're providing most of the care.
Yeah, 87%, isn't it?
It's actually over 90%, and it probably is more than that now. Dr. Janet Fast is an economist, and she says the notion is that healthcare is providing all the care, when in fact they're a small supplement to what family caregivers are doing.
Yeah, I'm reading the chat, Sharon, and Heather Walker is saying, and she knows she's a caregiver, all right. And if healthcare providers could understand and support that any diagnosis affects an entire family, not just the patient. That would be a profound improvement. And I think certainly this program is about helping that understanding along. And Rachel comments, the lack of healthcare support is also based on an institutional bias, which includes assumed scrutiny toward caregivers and needing proof. We go from private citizen to public property, living in a goldfish bowl, or at worst, a gladiator ring, fighting for the support of our loved ones' needs. Yep, that I couldn't agree more with that. You know, I think particularly where someone's health is very frail and very fragile, where family caregivers are expected to do nursing tasks at home, often with very little training. This is all of a sudden, if we make a medication error, if we don't understand how to do the dialysis correctly, and this is on families now. Feed the dog, make the lunch, give a G-tube feed. So I think personally, I'm very hopeful that this training will become embedded as core curriculum across all of the allied health, in the education. And I think because it does improve, you're proving that it improves healthcare outcomes. Not only that, but you were telling me just before we started our webinar today, Sharon, that it improves the emotional well-being and helps people, providers who are experiencing burnout. This approach helps them feel better and be more resilient in their healthcare professional roles. Tell us more about that.
Yeah, so we were asked to do the COVID-19 module, and it's really about those difficult conversations in stressful times. We focused on communication in that module, because communication is a soft skill, but it's the most important reason why stuff breaks down in healthcare and why there's actually malpractice suits in healthcare. And one of the providers that took it said that he watched the first video and he said, Sharon, the only thing that you didn't show when she's having to tell the caregiver that they cannot come in, that they are locked out, and this is it's a rule. She said, you didn't see her going back and pounding her head on the desk. And he went on and he said, I was so burned out, and this gave me hope. And we've heard that numerous times again. And we also heard that in our, in the study that we did of providing CISNAT and some extra respite care, asking caregivers what they need. So the case manager said, initially that asking increased their workload a little bit, but over the long run, it felt so good because caregivers would come back and say, thank you. This is working really well. And that's what people go into this for. They care.
Mm-hmm.
I don't know any doctor or nurse that went into this because they didn't want to make a difference or didn't want to do better. Where that care breaks down is at the system level. It's when people, it's that burnout that you get from not being able to do the things that you should be done. So that angst of seeing the caregiver doing all this work and knowing they're stressed, but knowing that I have a 10-minute appointment with the patient and I've got 30 patients that are waiting after that as a family doc. So we have to do something differently, as you say. So education, but we also need to work at that policy piece, that changing the culture and context of care.
Yeah, absolutely. What I really want to show people is the second video or part of the second video where we actually see what healthcare providers are learning in this program? If we show what typically happens, but what are we proposing as an alternative? That's what we're going to see right now.
In every passing decade, the quality and availability of healthcare to any ailing citizen has improved. And yet, even with all our ever-advancing knowledge, there remain pockets within the system that demand our attention, calling for positive change in attitudes and behavior. The world of caregiving is in fact one such area yearning for compassionate update.
As a healthcare system, we have a long road ahead. It's not difficult to find family caregivers who tell stories about failed care from the system, or such muddled communications between the family caregiver and the healthcare system that, on occasion, a measure of harm resulted rather than the intended care. We can do better. Not only better, but by partnering with family caregivers, we dramatically improve the quality of care, period.
When I began my career as a physical therapist a couple years ago, I came into the healthcare world thinking I had already learned a great deal. I mean, the schooling, the practice, the details. I felt like I was well prepared for my career. And I was, academically speaking. But then I started working with people, actual caregivers, taking care of their parent, spouse, child, or dear friend. And I ran into a few situations that I couldn't have imagined of when I was a student. I wasn't trained to deal with the staggering concerns of the people surrounding my clients. I didn't understand how much pressure was on the caregivers who lived with my clients, whose care responsibilities were much bigger, much more demanding than I could have expected. I was naive. In a real way, the healthcare system has been naive too.
Healthcare providers will all tell you, the angst that they feel in being in that situation, not having time, not feeling that they had the resources. In the partnering module, Dr. Elizabeth Drance is a geriatric psychiatrist, and she just provides all kinds of tools to help you with those situations, because both Dr. Drance and Dr. Michelle Lobchuk, who teaches In Your Shoes, Empathic Communication for Healthcare Providers at the University of Manitoba, both of them talk about how, you may only have 5 minutes, and what can you do in that 5 minutes?
Mm-hmm. It's so interesting because I think, I don't know this, but I imagine that if I were a healthcare provider with all of the difficulties, like there are so many pressures on healthcare providers today. And to me, it's like the same feeling as if you're walking down the street and a homeless person comes up to you and you don't want to engage. Why do you not want to engage with that homeless person? Because you're thinking, I'm never going to be able to get away. I'm never going to be able to meet the needs are so great that I can't even go there. What I'm looking for as a healthcare provider is a clean transaction of care. Vicky Kamak my friend Vicky, great thinker on family caregiving, used to use that term to talk about you're in, you're out, you're helpful, goodbye, and end of. But we don't have that when the needs of families are truly so great. But what you're proposing in this program, I think, is something that gives people the language to be, I'll use that word that I don't really like, empowering. You are empowering a family caregiver by being kind for 5 minutes. It's not always about saying, I can magically make somebody appear at your doorstep who's going to take over for the day next Thursday. No, it's something else. It's the language of kindness that is also helpful for people to be able to continue in their role. And it's about, how do you communicate that you understand what it's like for that husband who's got whose roof is leaking, the car is broken, he's got to carry his wife from room to room, all of the things that he describes. And I find it so interesting that we need to learn this, but I think it's deeply human because the needs of family caregivers are so great today, and they are being expected to be superhuman in the burden of care that they carry. So,
So you talked to Sammy Winemaker a month ago, and she talked about how you're going to deal with that palliative care from diagnosis and you're diagnosed with a condition, and that condition is going to be chronic and advancing, and you want to live that life. Can you imagine how simple or how much easier it would be? Life is going to happen. We are all going out feet first. The question is how do we live this life with kindness and hope and all of those kinds of things? Dr. Wendy Duggleby talks about hope at the very end of life and how it's so important. So how do we do that? And can you imagine what it would be like if every single healthcare provider was spending that 2 minutes or 5 minutes and asking family caregivers how they are and handing them off, that warm handoff to the next person? Or if you can't help them, because there's lots of things, how do you say, I'm so sorry?
yeah.
And because you are sorry, you can't fix, as that Dennis Misaki said that very clearly, you cannot fix everything, but you could walk with somebody.
Yeah. Walking with is a massive deal. And I can remember at the worst of times when we got a palliative diagnosis for our son. And he had uncontrolled pain and he was in the hospital and it was all terrible. And one of the doctors said to me, what can we do for you? And I was so overwhelmed. The only thing I could think of saying was, I need you to be nice to me. And I meant that really seriously. Like, I could not take a joke. I could not be teased. I felt like my skin was inside out. And if somebody blew on me, it would hurt. I just needed extreme kindness and somebody to walk with me. But I could say that, but I think it is profound that the work that you're doing with Jasneet and the whole co-design team is showing people, you can do this. You can do this. Here is permission. Here is how. And here is what you can do in 5 minutes to achieve this goal. Like, that's remarkable.
Yeah, well, and the thing is, this is what the caregivers said in 2017.
Mm-hmm.
We have to start somewhere.
Yeah.
I attended one of, we've got an election in Alberta right now, and I attended one of the sessions. There's another one, I guess, tonight or tomorrow night. I'm not sure which day it is. Where their politicians are talking about what they need to, what they want to do for healthcare. This was in particular, and so I said, look, these are wonderful things that you're doing. I absolutely agree. This needs to be done. This is desperately needs to be done. What are you going to do about caregivers? And this one politician said, we can't do that now. If we can't do that now, when will we? In 2000, back in 2002, Roy Romano said, the healthcare system is not sustainable without family caregivers. So at what point, if we couldn't do it in 2002, when will we care for caregivers? When will we care for healthcare providers? When will we work together? How do we fix this system together?
Yeah, that's so true. And I think I'm feeling optimistic now in Canada that we have the new Canadian Centre for Caregiving Excellence that is really pushing hard for a national strategy for caregivers. And this training program, I'm hoping will be part of that national strategy, and that everybody, all of our healthcare providers will have this education. But in the meantime, Sharon, I don't know if I told you this, but I told our family doctor about this program. I told my niece, who's a social worker, I asked her to promote it. We can hand this on a platter to the people we're working with in our profession, our medical professionals today. We can hand this to them and send them an email with the link, right? So you have to start somewhere.
Well, and that's the thing that happens is, and that's what you're doing in your caregiver essentials. How do you train caregivers? How do you help caregivers to talk to healthcare providers, to their family members, so that we work together better? But we also need to train those healthcare providers. We need both.
Yeah. So that's the URL for the training program, your program. And the name of the center that I referred to is the Canadian Centre for Caregiving Excellence. And that's a relatively new organization, but man, they're out of the starting blocks, making big change. They've got a white paper for policy, a national policy on caregiving support. And there will be a summit, a conference in November in Ottawa. And I think we are finally beginning as nationally, as a group of family caregivers, to bang the doors of policymakers and of universities and medical training institutions, everybody who has a role to play in assisting us, paying us to do this care work. I mean, it's a wraparound approach that I think, and this is part of it, but I think it's really interesting, Sharon, what you said. Go back to the beginning of 2017, when you first started talking to family caregivers who said, the biggest pressure we face is having to deal with healthcare systems, navigate them, talk to people, try to get included in conversations, try to understand that I am a key player in the circle of care, and I need to be treated as such. So I am hopeful that we're beginning to get some momentum in this country, to get something similar to what you described as what they have in the CARE Act in the United States. Are you feeling optimistic too?
Actually, you're absolutely right. The Canadian Centre for Caregiving Excellence has only been around for a year, but the difference that they've made as far as working towards a national strategy is wonderful. Certainly, people need to check out the summit, because it's in early November. Both of Donna and I are going to be there with bells on, and I think the cost is $200 for 3 days, including meals and the banquet. That's unheard of. So if you can if you can somehow scrape to find somebody to care, or find somebody to take your healthcare job for 3 days, and join us in Ottawa, and let's, because this is what we're all working towards, making that difference in caregivers' lives. And yeah, it just warms my heart when I hear from healthcare providers that they've really learned something, that this has changed changed how they feel.
Yeah. Oh, absolutely. Sharon, I want to thank you so much. We are nearly out of time. I hope that people will take the information that you've learned today. Take the course yourself. Go online to caregivercare.ca and take the course yourself. I did. I've done them all. I've done the quizzes. And naturally, as one of the many, 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 many co-designers who are working with you, Sharon, this is part of that process. But I think I would have taken it anyway, just out of curiosity to see, is this the training program that's going to work for me? Am I going to get the care that I need from my healthcare providers if they've taken this training? And my answer is big resounding yes. Yes. So everybody, it's free, it's online, it's open access. Go for it, take the course, and then share it with your healthcare providers or your colleagues if you are a healthcare provider. So thank you so much, Sharon. Any last words?
Oh, please do the pre-post questions, because that's how we're evaluating it at level 1 and level 2.
Yeah.
So, by taking that 5 minutes to do the pre-post questions, it makes a big difference to us, because we can tell what's happening, how much learning there is happening. The other thing that I can also tell you is I've been surprised at the number of people who said that the pre-post questions are thoughtful and made me think about what I've learned. So they're for evaluation for us, but for you, it's a way of reflecting. So thank you very much, Donna. This has been, I've got some Donna time. We've all got some Donna time today.
And Sharon time. Absolutely. And so thank you so much, Sharon, for joining us today. And it's just been a wonderful chat.